This is a dose expansion cohort, and which means initially it's looking at the safety of this combination because it's the first time that this combination is used, and then looking at the results and the response rates. And looking at the safety, one of the things that whenever you combine with an agent with an immunotherapy to see if you're increasing the immunotherapy toxicities, and also targeting EGFR and also immunotherapies, they both have potential risk for skin rash. So those are the focuses of the first part of the study to look at, and it seems like from the initial reports there hasn't been an increased toxicity from the immunotherapies, and skin rashes from the BCA101 is similar to what we know from the EGFR inhibitors, like the acneiform rash, and it seems like it's most manageable by the physicians. And looking at the results, the response rates are really encouraging. It's a small cohort, but looking at the responses, more than 40% of the patients had a response. And when we look at the analysis of the head and neck squamous cell carcinoma patients, we usually try to see like if there's any difference in HPV positive and HPV negative cancer patients. And looking at the sub-cohorts of these HPV negative head and neck squamous cell carcinoma patients had a better response. And this group usually tends to do a little bit worse, and we have limited treatment options for these patients in the recurrent metastatic setting, and having an option of the treatment that enhances the response to immunotherapy, because in this study, like they showed so far, more than 60% response rates in HPV negative patients, which is really encouraging.